At Utah-owned medical laboratory Beechtree Diagnostics. Matt, it is so nice to meet you. So much to talk about. Let's jump right in. What is Beechtree all about?
Beechtree Diagnostics is a laboratory located in Draper, Utah, and we focus on helping 3 different demographics of patients.
What are those? Let's jump into the first one, which is mental health, something we talk about and try to normalize all the time.
Right. So we have a really easy tool for mental health physicians to know if the patient's on the medication in the program or not. Unfortunate statistic is 60% or more of mental health patients, when we're working with a new facility, they're not on the regimen. The medications are effective, but they're only effective if they're taken appropriately. And we just give them a really easy tool so that they can assist the patient in their own mental health.
So they can monitor and know what's going on with that patient. The next one, substance abuse.
Yes, ma'am. So substance abuse is something we all take really personal here, right? If you have 1,000 people in a room and you raise your hand and say, hey, who do you know someone that suffers from substance abuse? Typically all 1,000 hands will go in the air, right? When we look at substance abuse facilities, we look at them as heroes. They're in the front lines fighting an amazing fight, and our job is to do 2 things. First, give them the absolute best transparency so they know what's going on inside that patient, right? Every patient that suffers from substance abuse is typically not proud of it, but will also go through enormous measures to try to hide a substance abuse issue. Our job is to identify that, provide the therapist and the physician with that information so they can have an honest discussion that it's in the open, and let's just heal.
Yes, and something that's near and dear the hearts of you and many of your coworkers here, so taken very seriously and made very personal. The last is pain.
Yeah, so pain doctors are in a tough spot. We kind of joke, you're between a rock and a hard spot, because there is pain, right? Pain is a real thing. I played football for many years, and I get pain, but I also get addiction. And that pain physician is tasked with the duty of managing the pain, but also watching for addictive problems. And we're proud to say that, again, it's all about transparency. So if someone's trying to hide something, we can provide that information to the physician so the physician can then have the appropriate conversation. It's all about saving that patient's health and the physician's license, to be honest.
Yes, saving them because you care. Now,